NCLEX-style practice questions with rationales, mixed difficulty, covering meds priority peds, psych med-surg and fundamentals. 1. Question, a nurse is caring for a client with COPD. Which oxygen delivery system is most appropriate to maintain adequate oxygenation without suppressing the client's respiratory drive? A non-rebreather mask, B. Venturi mask, C. Nasal cannula at 6 Lmin, D. Simple mask at 8 Lmin. Answer B. Venturi mask. Rationale. Venturi mask delivers precise FiO2 and is best for COPD clients who require controlled oxygen to prevent CO2 retention. 2. Question, a client receiving furosemide is at risk for which electrolyte imbalance? A. Hyperkalemia, B. Hypokalemia, C. Hypernatremia, D. Hypermagnesemia. Answer B. Hypokalemia. Rationale, loop diuretics increase potassium excretion, leading to hypokalemia. 3. Question, a nurse finds a post-op client with 250 ml of bright red blood in the chest tube drainage within 1 hour. What is the priority action? A. Continue to monitor, B. Notify the surgeon immediately, C. Milk the tubing, D. Clamp the chest tube. Answer B. Notify the surgeon immediately. Rationale, 100 ml/HR bright red drainage suggests active hemorrhage and requires urgent provider notification. 4. Question, which insulin has the fastest onset? A. NPH, B. Regular, C. Lispro, D. Glargine. Answer C. Lispro. Rationale, Lispro is rapid-acting, onset 15 minutes. 5. Question, a client is prescribed digoxin. Which finding requires immediate intervention? A. HR 62 BPM, B. Nausea and vomiting, C. BP 110/70ths, D. K plus 4.0. Answer B. Nausea and vomiting. Rationale, early signs of digoxin toxicity include GI upset, visual changes, arrhythmias. 6. Question, which client should the nurse see first? A. COPD with O2 sat 89%, B. Asthma with expiratory wheezing, C. Pneumonia with productive cough, D. Pulmonary embolism with sudden chest pain. Answer D. Pulmonary embolism with sudden chest pain. Rationale, this is life-threatening and requires immediate intervention. 7. Question, a nurse prepares to administer blood transfusion. Which action is correct? A. Use a 24-gauge IV catheter, B. Hang with lactated ringers, C. Verify client ID with another nurse, D. Infuse over 6 hours. Answer C. Verify client ID with another nurse. Rationale, 2-nurse verification prevents fatal errors. Blood should run with NS, large bore needle, max 4 hours. 8. Question, a client with schizophrenia says, the FBI is controlling my thoughts. What is the best response? A. That's not true. B. Tell me more about these thoughts. C. You're safe here. D. Ignore these thoughts. Answer C. You're safe here. Rationale, acknowledge the client's feelings without reinforcing delusions. Provide safety and support. 9. Question, a nurse prepares to administer vancomycin IV. Which finding is most concerning? A. Red flushing during infusion, B. Creatinine 2.5 mg/dl, C. Mild nausea, D. Low-grade fever. Answer B. Creatinine 2.5 mg/dl. Rationale indicates nephrotoxicity. Priority to report and hold. 10. Question, which assessment is priority in a client with DKA? A. Daily weight, B. Breath sounds, C. Potassium level, D. Temperature. Answer C. Potassium level. Rationale, insulin therapy drives K+ into cells, causing hypokalemia, right arrow arrhythmias. 11. Question, a child with sickle cell crisis is in severe pain. What is the priority intervention? A. Administer oxygen, B. Provide IV fluids, C. Give opioid analgesics, D. Apply cold compresses. Answer C. Give opioid analgesics. Rationale, pain is the hallmark. Opioids are priority. Hydration and O2 follow.